So this week, a new paper came out by Jamjoom and our group here at Sick Kids, and it's a paper about using point-of-care ultrasound in the detection of cancer in pediatric patients. And I just wanted to talk for a minute about what this article really means, and why it's so cool. So in all of these cases, there are 4 cases that we discuss, and in each case, the provider that was caring for the child had used point-of-care ultrasound frequently in their practice and understood the anatomy of the common views they were using. And when they were confronted with a clinical scenario that was a little bit complex, a little bit confusing, but was isolated to particular anatomy, they used point-of-care ultrasound as an extension or as augmentation of their clinical exam, and what they determined was that there was abnormal anatomy there. And that helped kind of guide their downstream care and directed them towards the appropriate specialty consultation and the appropriate advanced imaging. So for example, a patient comes in and has a little bit of a proptotic eye, that we think maybe it's periorbital cellulitis, but it doesn't quite fit, and when the point-of-care ultrasound is done, we recognize that there's clearly an abnormal mass posterior to the globe, and this was a rhabdomyosarcoma. So here, it immediately led to an MRI. Now, how would that case have been handled traditionally? Potentially the patient could have been sent home and on another trial of antibiotics. More time would have passed. The proptosis probably would have gotten worse. Other symptoms probably would have occurred, and ultimately an MRI may have been ordered. But clearly, point-of-care ultrasound and the examination of that anatomy help direct things in a timely fashion. So check out the paper. It goes through a few other cases. There's 4 cases in total, and it talks about this transition from us thinking about point-of-care ultrasound as a binomial agent to something that really is augmenting our clinical examination. And I think as time goes on and as we have more mature users and users that have used the technology of ultrasound through the entirety of their career, you're going to see this more seamless integration of point-of-care ultrasound becoming part of the clinical examination. And it's going to be an incredibly exciting time, and it's going to be one that we're going to need to research really well. But my hunch is it's going to lead to better care, safer care, and more resource-efficient care.